What can I take for wrist pain? Is a question I hear frequently as a physician that hasn't been answered by computer, other doctors, or even people's friends. Wrist pain is a pain that is frequently left undiagnosed, untreated, and people just have to suffer through it. So what can I tell you about how to be able to assess and evaluate wrist pain? First and foremost, it can come from a number of different issues, and those issues have their own specific treatment. So it can come from the tendon, it can come from the bone, it can come from the joint, it can come from the aspect of the muscles, and those things need to be evaluated and assessed. If we haven't met, I'm Dr. Orlando Landrum. I'm an interventional pain and regenerative medicine specialist who emphasizes that patients need to understand how to be able to treat their own problems, but also have an understanding about what their different options are. So today we're going to talk about wrist pain. When talking about wrist pain, we need to have a few things understood. Some of those things that need to be understood are, first, is this something that you can treat only at home, or do you need to seek the advice of a doctor? And one of the ways to be able to tell that is when you do different movements, do those movements actually cause the pain to be worse? So if you were to take your hand and you were to actually make a fist and you were to bend it forward and you hold it for 60 seconds, do you have numbness and tingling? If that's something that does not occur, then it very well may not be carpal tunnel. So you may not necessarily immediately need to seek the advice of a physician. If it is, and you start having numbness and tingling is present in your hands, then that may be something that needs to be evaluated with a little bit more of a critical eye. The other thing is, if you grab and you hold onto objects and it's difficult to be able to have that grasp be sustainable and strong, and you feel it starting to loosen and weaken, particularly over time, those are things that need to be evaluated as to what is the why. Some of the tests that your doctors may do in order to be able to evaluate why you're having a problem. Of an x-ray, they may consider doing an EMG, which is basically a test of the nerves to see how well they function. They may get blood and they may get urine tests to see if you have crystals or other things that are present in your blood that may be indicative of something like an arthritis. So what are some of the treatments that you can do in order to be able to improve your overall pain? So first and foremost, people think about taking anti-inflammatories, and immediately what many people consider an anti-inflammatory of choice is something like ibuprofen or aspirin. Well, those two medicines have their own issues that are involved with them, particularly kidney type effects. So if you're going to take that and it helps, then you need to take it in moderation, and you don't want to take it for an extended period of time. You need to speak to your healthcare provider about that, particularly if you have other medical conditions that may worsen the side effects of those meds. Another potential substitute for something like that would be something like turmeric, used in good conjunction with other evaluation of side effects that might occur with interactions with medications. If you believe you have something like carpal tunnel, which is that aspect of a narrowing around the median nerve, like we talked about with that bent wrist, there's some things that you can be able to do to try to improve that. You may consider using a splint, particularly at night, that it's able to keep the wrist straight so you don't have as much of an issue. You may consider using some degree of icing. You might look into certain different types of wrist garments that actually improve the blood flow there, things like Incrediwear that you may want to consider. Check the link down below and we'll refer you to something. If you have a process in the wrist like gout, which is that collection of uric acid crystals, one of the things that you want to do is to change your overall fluid and dietary status. So you do want to increase your oral intake of fluid. In essence, you want to be able to drink more water to dilute the amount of uric acid crystals that are present that are causing you the issues with the joint. 2, you want to change your diet. You want to decrease the aspect of high fatty foods and alcohol intake to be able to improve your relative uric acid crystal to serum blood composition. If it's due to an injury, you need to assess how soon is this pain started after the injury and whether you need immediate medical care. If you feel like it's a sprain and it's something that you can be able to work through, those are things that you may be able to treat initially with some degree of rest, possibly a little bit of icing, though that's becoming a bit controversial now, and whether you need to take an anti-inflammatory, and I would lean towards more of a natural anti-inflammatory if you can. So not so much ibuprofen and aspirin, but something like turmeric if you can, to be able to try to improve it. In addition, you want to then start working into exercises that make sense. Exercises like thumb touches, so where you're taking your thumb and you're touching it to your pinky, your ring, your middle, your finger. Again, pinky, ring, middle, index finger. And you're going to do that with some degree of rapidity and repeating it to try to be able to improve that muscular function and see how it stresses the elements of the wrist. Another exercise that you can do is something that's called fist to fan. So where you make a fist and then you spread your hand as wide as you can. So you make a fist and you spread your hand as wide as you can. And then you want to think about doing things like wrist flexion, extension, and wrist deviation. And so those are going to be things that you're looking to be able to try to improve with a period of time over time. And there are other exercises that you can seek out from your healthcare provider and physical therapist, but those are starts on how to be able to get that wrist pain diminished and eliminated. So those are treatments for what you can do in order to be able to improve your wrist pain and not just take a medication, but hopefully be able to improve the underlying problem. If this video is of value to you, please hit the like and subscribe button and check out some of our other videos linked here. Thank you.